Have you ever had trouble sleeping at night? You know, the kind of sleep where you want to sleep but you just can't? You want to sleep like this, but in all actuality you feel like you drank all of this? Well, it may be due to one of these: a medical or physical condition, environmental issues, medication troubles, working nights, or genetics. Just as the candles on our birthday cake grow and continue to grow, you might notice that you wake up earlier or you get up through the night. Sleep disorders in the elderly involve any disrupted sleep pattern. This can include problems falling asleep, staying asleep, too much sleep, or abnormal sleep behaviors. Some of the causes or contributing factors in sleep disturbances in the elderly include a diagnosis of Alzheimer's, the use of alcohol, certain medications, which include side effects of certain medications, herbs, supplements, and the possibility of recreational drug use, changes in the body's natural internal clock, and it causes some people to fall asleep earlier in the evening. Not being active also plays a contributing factor into sleep disorders. Frequent urination at night. Diagnoses such as depression also causes sleep disturbances and disorders, and so do stimulants like coffee and nicotine. As you can see in this slide, insomnia, sleep apnea, periodic limb movements, restless leg syndrome, and REM sleep behavior are all primary sleep disorders. The most common sleep disorders found in the elderly are insomnia, sleep apnea, frequent awakening during sleep, awakening early in the morning, daytime fatigue, irritability, and difficulty with concentration. Sleep disorders can very well be diagnosed with a quick medical exam. Sometimes they perform sleep studies. Sleep studies are usually conducted at a hospital. Sticky patches with sensors called electrodes are placed on your scalp, face, chest, limbs, and fingers while you sleep. These sensors record brain activity, eye movements, heart rate rhythm, and blood pressure, and the amount of oxygen going into your blood. Elastic belts are placed around your chest and belly. They measure the chest movements and the strength and duration of inhaled and exhaled breaths. Wires attached to the sensors transmit the data to a computer in the next room. The sleep study can be followed by a diagnosis, which may require someone to take medication. And people can be diagnosed with sleep apnea, which requires the use of a CPAP machine at night while they sleep. Sometimes just talking to someone and letting them discuss the reasons behind their sleep disturbances, though occasionally there may be no specific reason, but they're willing to communicate their worries to you, and that could help improve their quality of sleep. You can also assist individuals by helping them keep track of their daily living habits and trying to pick out what they may want to change to help them sleep better. There are many different things that individuals can change in their lives, but there's also some at-home treatments or remedies that they could look into as well. Like the good old counting sheep. That's just a relaxation technique. And then the infamous glass of warm milk. Did you know that drinking a glass of warm milk before bed helps boost serotonin levels in your brain, which helps you prepare for a good night's rest? You can remind the elderly not to eat large meals before they go to bed at night. You can assist in keeping them active throughout the day and getting good exercise. And maybe give them the encouragement to avoid alcohol, caffeine, and nicotine, because those stimulants just are not good for us before we go to bed at night. The no nap club may be difficult later in the afternoon, but try to encourage individuals not to nap early in the day as well. Without normal sleep, a person may receive a wide range of physical and psychological, as well as cognitive problems. Sleep deprivation can lead to serious health problems such as heart disease, heart attack, heart failure, irregular heartbeat, high blood pressure, stroke, and diabetes. Sleep plays a critical role in thinking and learning. Lack of sleep hurts the cognitive process in many ways. First, it impairs attention, alertness, concentration, reasoning, and problem solving, and this makes it more difficult to learn efficiently. Sleeplessness is depressing, and lack of sleep can contribute to symptoms of depression and anxiety. The most common sleep disorder is insomnia, and it's the strongest link to depression. Now that we know how sleeplessness affects us, we can implement ways to help the elderly and even other individuals learn to sleep better at night, because sleeping is healthy, and being healthy is beneficial to everyone around us.